We are really excited to have Barbara here from the Ohio Grandparent Kinship Coalition, and she's going to share some information about the history of kinship care in Ohio, the past and current needs of kinship caregivers, as well as ways you can get involved to advocate and support kinship caregivers as a caregiver yourself, including the March on the Capitol for Kinship Care Month. So thank you, Barb, so much for this presentation. Enjoy.
So this is our new logo. We a couple years ago we decided to sort of change our look, and so now we have this new fancy logo, and hopefully it's eye-catching and attractive, and gives sort of a little bit of information about the coalition without a whole lot of space. So we are Ohio statewide kinship navigator program since 1998, when it was sort of brought on board through the State Department of Job and Family Services. And it definitely is where your voice is heard. And we're going to get into that a little later in terms of what that means for caregivers. Just to give you a little background, and I'm not going to do a whole lot of, the data stuff, but kinship's always been around for centuries. I mean, you have cultures and religions and races that have embodied kinship care throughout history. They've always taken care of not only their children, but their elderly. And so this is not anything new. But what became new is when it was really recognized as a support that was really needed. And that happened in the late 1980s and early 90s with the heroin and crack cocaine epidemic. Similar to what was going on here with the meth and the epidemic recently with methamphetamines and some of the other things that were coming on the streets. So back then, it resulted in a lot of kids coming into the child welfare system. Parents weren't able to care for the kids. They were out doing the drugs, and they were taking kids, and they found out that they couldn't afford it, that the child welfare system didn't have the money to take care of these kids. So somebody decided that, well, we have to find an alternate placement for these children. And so they decided that they needed to really go into the family and look at who is in this family that could maybe help take these children in and do what they need to do for the children. And so in order to reduce the numbers in the system, they began to look at putting supports in to help kinship caregivers take these children and keep them out of the system. Maybe not for all the right reasons. A lot of it was the money that it costs to have children in the system. But if you look outside of that, the best place for a child is with a family or with somebody who is familiar with that child and their family and their history. And so it worked out in terms of that goal. In 92, the Department of Human Services, which is now Job and Family Services, they established a kinship preservation program, and it was part of the Annie Casey Foundation. That's a foundation that promotes families and supports families at a national level, and sometimes they give money for states to do things. And through that program, relatives were able to receive a cash payment of $500, or they could get 6 months of services, such as if they needed beds, clothing, additional supplies in the house to bring that child in, then they could receive that for 6 months. That program lasted as long as the money was there, and eventually the money was not there anymore. So that's what happens a lot of times. Money comes in, and then when it stops, the program stops. But at least it was something to get started, and it was something for people to look at to say, hey, this is something that we need to try to continue and maybe even expand. So then in 1997, the Ohio General Assembly, which is the legislative body, they said that they wanted the Ohio Department of Aging to develop a report on grandparents raising their relative children. And this was spearheaded by the late Representative Barbara Boyd and Joan Lawrence, who I believe is still around. But these two women who were in the legislature in 1997 said that they wanted Ohio, or the Ohio Department of Aging, to look at the issues around the kinship caregiver families. So as a result of that, in 1998, the report was finished and it was released. And at the same time, because the group that helped do this report was a group of grandparent caregivers. And that group at the same time decided, hey, you know, here we are working on what we need and what others we want others to help us with, but we need to get together and decide how we're going to advocate for ourselves. So what they did was they formed the Ohio Grandparent Kinship Coalition. This was back in 1998. At the same time that report came out. And so as a result of this group and the report, in 1999, the Ohio Department of Job and Family Services brought together about 1,300 individuals that were either kinship caregivers or involved with kinship caregivers, organizations, agencies that supported them. They asked these individuals to look at what the programs and what the social services needs were for kinship caregivers. And what came out of that, there were 5 individual recommendations: creation of a navigator program, information and referral, like a 211, statewide resource guide, a kinship advisory council, and then a separate unit within the Ohio Department of Job and Family Services that dealt with kinship care. And that's the year that I started working at ODJFS, and I happened to end up in that Office for Children and Families, and I ended up working in the adoption, foster care, and kinship care department. And so part of my responsibility was to develop this statewide kinship program based on some of the recommendations were made. So one of those recommendations down here is the Navigator program. In 2000, that was created then in 2000, and I'll get to that just a minute. But I wanted to show you this task force program that was done in 1999. I'm just going to go through it, but I wanted to show you how they came and brought these things together, and the people that were involved in bringing it together, and the coalition. This is the front page of the report. And so, all right, Angela will put that on the website for her, or send it out and then it's probably not going to do me any good to try to bring this one up because it's the same thing. But I was going to show you the other publication that was requested was to do a statewide resource guide for relatives for caring for children by ODJFS, which again, while I was there, this is something we developed, and they have made it current. It was revised January of this year, 2023. So if she puts this link up, it's more or less a resource guide. It goes into a lot of issues around legal services, custody, what kinship care is, other kind of supports and resources. And it's almost like it's something that the navigators would use, but this is something you can go to and see what's available at the state level. And then at the back of the book, there are county resources. So if you go into your county, you'll also see county resources that were available to you, on a county basis. So it is a little bit of a support for the navigator piece, but it's been around since 2000. So it's something that has evolved for the last about 24 years. But to get back to the report that I wanted to try to show you, I wanted to tell you and list the recommendations they make, because I want to link it and connect it to something later in the presentation. So I'm just going to go real quickly and run through the recommendations that this report, which keep in mind it's 1999, it's 24 years old this year. And I'm going to tell you what the recommendations were in this report. There's 12 of them. I'll go through really quickly. One of the concerns was legal relationships. Then the second one was access to assistance, and they were talking about their financial ability to care for the children. The third was health needs, and this was talking about health care for children and making sure that they were able to get medical visits visits, dental care. And if any of you have been involved with the dental care survey that we were doing earlier in the year, this is something that's leading up to improving dental care for children. Concern number 4 was getting immunizations. I know we've run into situations where caregivers have a difficult time getting their children immunized if they didn't have a power of attorney or custody, but they wanted to make sure that children were able to get immunizations. Number 5 was the emotional health of the child, mental health issues, mental health services. That was one of the ones that they felt was important. Number 6 is physical health of the grandparents. They wanted to make sure that grandparents were healthy and were able to take care of the children as well as take care of themselves, because if the caregiver is not healthy, then they can't do for the child what needs to be done, and they can't do for themselves. So that was another concern. Number 8, social activities, making sure that the kids were connected with recreational and social activities. Many times I have caregivers calling and wanting to know how they can get their kids in summer camp, how they can get respite for them, how they can get them in different kinds of activities. They want to play football, they want to play baseball, they want to be involved in the same activities all the other kids are involved in. So, and that costs money. And I know I have, my daughter has 3 kids in baseball, travel baseball, and they had to take out a second mortgage to support those kids in the baseball. So, it's expensive. And so they wanted people to figure out a way to support and subsidize some of these activities that kids really need. They need these activities when they're growing up to give them a way to be part of the group, be part of the society, be part of their peer group, and do what other kids are doing and not get in trouble. Increased financial assistance to low-income grandparents. That was number 9. Again, we're always talking about families need more money. There's got to be some financial support to these families, or else if they come into foster care, it's going to cost 3 to 4 or 5 times more if they're in foster care, and it's not the best place for them. Number 10 was grandchild care, and then 11 was school age care, and these sort of go together. Talking about child care, talking about there are still grandparents and caregivers who work. They need to work, but they need child care, and sometimes the child care is more expensive than what they earn. And I've had grandparents say and caregivers say, I've had to quit my job because I couldn't afford child care. And unfortunately, child care, they base the eligibility on the caregiver's income, and that's one of the things that we're really trying to get changed. And that's one of the things we'll need help with caregivers to help us get that changed. Number 11 was, I did say school age care. I'm sorry. Number 12 is help with adoption. And adoptions don't happen very often, but they do happen for different reasons. And I wanted to show you when I was talking about the person that was on the cover. Her name is Sandy Powers, and she was one of the people who was one of the founders of Ohio Grandparent Kinship Coalition. And at the time, she and her husband, Don, were caring for their granddaughter, Tasana. And Tasana's mom was having issues with substance abuse. And so Sandy and her husband took Tasana in, tried to, help her mother get into treatment and do what she needed to do, get rehab. But it was a long process. And so Tasana stayed with Sandy and Don. Unfortunately, Don became ill with cancer, and he was going to be eligible to pass along Social Security to Tasana, but the problem was they needed to adopt her. And when they found this out, he was very sick, but they were able to go into the process of adoption. They were able to adopt her, and then he died shortly after that, and she was able to get the death benefits. But there's that whole dynamic of Sandy went from being just grandma to then grandma and mom in a role, and then Tasana now, well, this is 24 years ago, so because Tasana is probably in her 30s, she has her own children. So now Sandy is a grandma plus a great-great-grandma to these children. So there's the real complications of being in that situation and all the legal and all the relational responsibilities and issues that come along with becoming a caregiver. But things have worked out well for them, and I think Tasana is a great person. And she came to our 2020 rally at the State House and talked and had her children there, and Sandy was there, and really, really a good story. Um, so just a real quick overview. We've already talked about OGKC coming in terms of uh, being developed by grandparent caregivers at the time, and then eventually other caregivers. But the main focus of OGKC is that it's a place where people can advocate for political and social awareness of what kinship caregivers are going through. And we try to be inclusive. We want to make sure that the caregivers are represented, as well as agencies, organizations, and others who are interested in advocating for caregivers. OGKC has 6 officer positions. There are 2 co-presidents, there are 2 co-vice presidents, a secretary, and a treasurer. I held the secretary position for a number of years, and just recently was able to transition that to Roxanne Dickel, who is in Darke County, and she's doing a great job of taking over. And so right now we are short of a co-vice president. So if anyone's interested, and we want to try to keep it at a caregiver and a person from an agency and those co-president and co-vice president positions, because we feel we need that balance. So if any caregiver is interested, my email is at the end of the presentation, and reach out to me or reach out to Angela, and we will look at trying to get you on board, because we really want caregiver to be part of that whole decision-making process. So the mission of OGKC is to educate, engage, and empower caregivers. And those other agencies or individuals who want to make people and policymakers, legislators, stakeholders aware of the needs of kinship caregivers. And our vision is to be the voice for caregivers, but also empower caregivers so they can be the voice for themselves. But we want to make sure that the children's services agencies who are in the position of taking in children when their parents can't or won't take care of them, or are not able to for whatever circumstances, make sure that they're following the federal requirement that if they take a child from their biological parents, they have to look first for the placement in either a relative or a close family friend who is familiar with the child and the family, placing that child with those individuals, and to meet the cultural needs and the needs of that family. And that is a federal requirement. And so we work with the Ohio Department of Job and Family Services. We meet with them regularly, and we take in calls when there are issues with placement of kids with their relatives, that the approval process is not being done. We have a connection to the ODJFS ombudsman, and make sure that what the agencies are doing is meeting that requirement, that they look for relatives first and make sure those relatives are aware of their rights and responsibilities when they need a placement. We also want to make sure that what caregivers need, and make sure that they're adequate and equitable supports are provided to kinship caregivers when they have children placed with them, especially when they aren't with Children's Services. Because in Ohio right now, we have, according to the Census Bureau, and they only capture grandparents. So we're not talking about the aunts, uncles, brothers, sisters, cousins, the neighbor next door, the teacher who've taken kids into their homes. Just grandparents. Over 100,000 grandparents in Ohio take care of over 200,000 kids. And these were kids that are not necessarily placed by Children's Services. These are children who've come into your home. Either you may have power of attorney, you may have custody, you may not have any of that, but you've taken them into your home. And because of that, then it's hard to get services sometimes. There's nobody there to support you. So we're there to try to make sure that we help get those services that you need and help you understand the services that you need and where to get them. So, and again, we go back to being the kinship navigator since 1998. And these are some of the goals that we have. We don't want children going to foster care if it's at all possible. Foster care is a good situation when a child needs it, but if there are other options that are better, then we want to make sure that those happen. We want to improve the awareness about the needs and issues of kinship families to make sure that there's legislation that supports them and policies that are put in place, for example, with ODJFS, to help increase supports and take barriers away from kinship families. So you don't need any more barriers or any more hurdles to go through than you already have. We want to make sure that caregivers have access to resources that help with the health, safety, and well-being of both children and caregivers, and use research and best practices on national trends and state data to improve the understanding of what caregivers need. And to sort of give an example of that, early in the year, OGKC sent out a survey to caregivers and other organizations to complete some questions that we had about what's going on with kinship care in Ohio. We got probably close to 100 responses, which is pretty good. We are now in the process of putting together a final report about what we received back, and hopefully we're going to have this in September. And of course, once we get it done, we'll send it to Angela and she can get it out to everybody there. I'll send it out to all the contacts that we have in OGKC. So you'll get to see what the responses were and what they mean for kinship families. And then last but not least, we want to build our capacity, the OGK capacity, our ability to achieve all of these missions, the mission and the goals and the vision. And to do that, we try to raise money. We don't have a lot of money. It's hard to get grants and money from other organizations, but we're out there trying, and we've gotten a little money, and hopefully we're using it wisely. We try to give out some to caregivers with our gift cards during the Zoom meetings. We've done some other things, and so we hope to continue that and trying to increase our financial support so we can help caregivers. Now, when I went over those 12, the 12 issues that caregivers rose about 23 years ago in that report, if you remember the 12 or some of some of them, you'll look here, and these are caregivers' needs that have been identified today. And if you go down this list and look at all of those, you'll see the majority of these that are still there today were back in 1999. And that's sad. That's sad. It makes me sad because I was back there. We were trying hard. We had a statewide navigator program back in 2000 that we did with $3 million. This is before the big one, the Ohio Kinship Adoption Navigator program that's out there now and is doing good work. We've worked with them since they've started. But it's sad that we haven't gotten any further than this 24 years later. And our goal is to this year and moving forward is to get some of these taken care of. But we can't do without you. If legislators work for us, our tax money and our tax dollars pay for the legislator's salary. So don't ever feel like you can't go to them and let them know what kind of job you want them to do for you, because that's why they're there. That's why we elected them. We elected them to go to represent us and our needs and what we need to be healthy and happy, and our children are the same. So, and I know how hard it is and all of the issues that you guys have caring for these children, and it's hard for you to get away. But if there's any way possible to be part of the September 6th Kinship Day at the Capitol, down here in Columbus at the state capitol, we are meeting from 10 to 1 on September the 6th. And if you can attend, you need to register because we are providing breakfast and lunch, and you can bring the children just as long as you register them because we need a head count in order to order the right amount of food. But we need your voice because what we plan on doing after the program in the morning, and we have legislators who are going to speak. It may not be yours, but we are going to have a number of legislators speaking. We have the Deputy Director of Ohio Department of Job and Family Services, who is over the kinship area. He's going to be there speaking. And then I believe we have up right now 4 caregiver families who are going to tell their stories. And this is what's going to catch people's attention. All those other people people are going to listen to them, but I guarantee you when those caregivers get up to speak, the whole room is going to be quiet because the stories they're going to tell are powerful. Your stories are powerful. We just couldn't fit everybody in, but you will have an opportunity then to once you are registered and you're able to attend, to come to that. And at the end of the lunch, which is probably going to be about 12:15 after we have lunch, we are going to give you packets of information. We're going to give you some pamphlets and a flyer to hand out to the legislators. We will identify who your legislator is, your senator and your state representative. Um, the Senate building is right there in the Capitol building. The Representatives building is on across the street. High Street is in the tall Rife building. There will be people that will help you get there, but we'll have your legislator's name, where they're located, the room number, and then we'll also have your talking points, what you're going to let these legislators know that caregivers need. And we've taken these from those needs that I showed you earlier. We've taken them and sort of boiled them down. And then you will have flyers to leave with them with this information on it so they have it there. And what we hope will happen is that your voice will make an impact on them. So when an opportunity comes up for them to either introduce legislation or be part of legislation, they're going to step forward and say, I talked to so and so who is a caregiver of 5 children, and these are things that she told me they needed. And so, yeah, let's talk about this. Let's talk about where we can get some money to improve that family's life and what we can do to help them. And so by leaving this information with them, it'll be there in front of them. They have aides that'll be there. And in the majority of cases, we will probably talk to their aides. And that's not a bad thing because sometimes the aides listen more than the legislator does. So however it works out, if we talk to the legislators or if we talk to the aides, it won't matter. We'll get your point across. We'll leave them with information and hopefully make an impression on them that caregivers count, caregivers vote. And that's what they want to understand, that, hey, if you are going to run for reelection and you want my vote, you have to listen to me and then you have to do something about my situation. We want to increase the OWF child only TANF payment. We want to increase it to at least $600. We want it to be per child, not just, $400 for the first child and another $50 for the next one. That doesn't make sense. We want to get the child care. We want to take away eligibility of the caregiver's income for child care. We want it to be like the OWF. You don't look at your income for OWF. We hopefully want to do the same for food stamps because they use your income for eligibility for food stamps. But 6 of us at OGKC can't go to all these legislators' offices. So we need you, we need your voice, we need your story, because that's what makes a difference. I've been in hearings for bills where one time it was for children with disabilities. They were trying to keep those children in their homes, and what was happening is they were talking about cutting the budget and cutting out the home health care for these kids. These were kids that are in wheelchairs and really dependent kids. And there were families there that brought their children in the wheelchairs, and these wheelchairs where they had to lay back, that some of them had tubes running in them. They brought them there, and the legislators had to pay attention to them because they're right in front of them. They saw what these families were going through with these kids. And then to say that we're going to cut the money for the home care that you need to help keep this child in your home, it wasn't they knew it wasn't right. So these are the kids that make, or these are the things that make an impression on legislators. These are the ones that find the money to do what needs to be done. And if you don't speak up, there's always somebody else out there wanting money. And if they're there, that's who they're going to listen to. Another example of that is just this past budget, there was an adoption group. And sometimes it takes years to get legislators to listen and to do what needs to be done. But this adoption group was able to meet with some legislators before the budget was passed. And however they did it, they took their voices and met with the legislators that were doing stuff with the budget. And after they met with these legislators, they ended up with, I don't know exactly the total amount, but they ended up with money in the budget in order to support adoptions, post-adoption. This is after they've adopted. They are getting anywhere from $10,000 to $20,000 per child that they've adopted. These are not just adoptions through children's services, but these are also private adoptions that people have gone to and say they've gotten an infant. The mother, they worked with a private agency. The mother had the baby. They get the child as an infant. They don't have to go to children's services. They spend a lot of money getting these kids. Well, this budget allowed for them to get this $10,000 and $20,000 subsidy because they adopted. Now, this was a group of adoptive parents going and talking and making an impression. Believe me, you have stories that are equal to, or maybe even more powerful than the adoptive parents, but they need to be heard. And if they're not heard, then people are going to think, well, they're okay with what they've got. Well, it's not okay. And so we need you. I know it's hard, but if there's any way you can, please come down to the Capitol for a few hours. Bring the kids if you have to, but we need you. We need your voices to make a change, because that may be hard now to arrange to get there, but it's going to be harder when you don't get the increase in TANF, when you don't get the child care, when you don't get food stamps, and you can't get other supports because nobody thinks it matters, because nobody's saying that it matters. So we will be there, and we hope to see you guys there. If you want to register, I know Angela has had it up on her website for the last few weeks. If you go to the OGKC website, and I have it here as a link. If you go there, it's right on the home page. You can click on it. You go to Eventbrite. It'll ask you how many tickets you want. So if you're bringing a couple of kids, or if you're bringing somebody else with you, make sure you put the number of tickets, and then it's going to ask for your name. If you can, make sure you put each individual's name in. If not, that's fine, but we're trying to make name tags up for everybody. So, but if not, we can do them at the event. So there is where you can go. Either go to our website or go to Angela's website. Here is my information, my email information. So if there's anything, I know a lot of you already have it, which is great. If you go to OGKC website, there's another email that if you have questions, you can click on that, and it comes directly to me too. So however you want to get a hold of me, that's not a problem. Go to Angela, she'll give it to you. But yeah, I'm available to find information or try to help out with issues that you're having. But please talk to your friends, talk to the other people who attend the support group, because I know a lot of them couldn't be here probably because school's starting. But hopefully in the next coming weeks, Angela can continue to promote it. But it's something that people have to make a sacrifice for, because if we don't make the sacrifice now, it's you're just going to keep struggling with what little bit that they give you and think that it's okay, and we don't, and it's not. We know it's not, but we need to speak up. And thank you for all you do. You are a blessing to your children. You're a blessing to everybody that you touch, and people know about you. So thank everybody everybody for what you do. And I thank Angela for giving me this opportunity. And if there's questions, I'm willing to try to answer them. Thank you, Angela.
Oh, I'm on mute. Thank you. I just wanted to make sure you did mention the monthly meetings you all host as like a way to get involved too.
Yes, I'm sorry. You're right. Obviously, I think a lot of you have, like Janet, she was yesterday. I know a lot of you have attended our monthly meetings. If that, the other thing I should have said while I was there on that slide about the our website, if you've not ever gone to our website and you don't receive our monthly meeting notices or any event notices, please go to the website. And when you go on there, the first thing you're going to see is a pop-up for MailChimp, and it'll ask you if you want to subscribe. If you want to be on our mailing list, please subscribe, and then you'll go into our contact list, and anytime anything's sent out, you'll get information. So you'll get information about our Zoom meetings, you'll get information about any upcoming events like the advocacy day, anything that's going to be going on will come out through the contacts. So if you're not already subscribed, please go to the website and subscribe, and you'll be getting updates on everything that's going on. And you can always go to the website because we have all of those things posted, the dates for the Zoom meetings, the information about the upcoming event, and then there are all other kinds of resources. We put Angela's meetings on there, what the presentations that she has, we put on there. Our Zoom meetings, we have videos, recordings of those. So if you haven't gone to them, and the one yesterday was the education of children with disabilities, dealing with IEPs. If you weren't on there and you need some help, go to our website and go to resources, and that will be up there too. The handouts and the information she provided and her contact information. So thanks, Angela, for that.
So I hope
Okay,
some of you all can make it. I mean, September is Kinship Care Month. So
right.
it will be a month-long celebration. I know that's when we'll be getting together as a group as well. So again, I hope to see some of you all there. And thank you, Barb, for all this helpful information.